Children's Services Division, around 430 of us in the team, offering a wide range of professional services across the city of Bristol and into South Gloucestershire. It's a great time to be thinking about joining Bristol Community Health, particularly in the Children's Division, as we're offering a whole range of exciting initiatives. You can find yourself working in a whole variety of settings, from in the home to schools to children's centres and into clinical settings. One of the key components of the Making Lives Better strategy is putting people first. And when we say putting people first, that's not just the children, young people and the families that we support, but it's our own staff. So we're very centred around what's best for them, what training do they need, support and advice, and making them part of a team, which absolutely puts them at the centre of what we do.
So I'm Gabby and I'm a school health nurse. We are a public health nursing service and we're a team of school health nurses and school health assistants. We work with the multi-professional team to deliver a health service to school-aged children and support their families. So we cover physical, social and emotional health. Each school nurse is allocated a number of primary schools and a secondary school. So we provide a drop-in clinic in our secondary school weekly. And that means that young people are able to come to our drop-in clinic and seek advice on their health. So I worked with a Year 6 pupil who was going on Year 6 camp, and she was very nervous about staying away from home but was excited to do the activities. We worked together on a one-to-one basis and made gradual steps to manage her feelings of anxiety. A few months later she sent me a card to say she had been on camp and had a lovely time and thanked me for my support.
The main focus of occupational therapy is working with children of all ages with any disability or long-term condition or illness, and we work towards getting them to be more independent with all the activities that they do on a day-to-day basis. For me, it's a unique opportunity to work and meet people in their own environment, so meet the families and the children at home, and for the children to see them at school, and to help them then achieve their goals in their natural environment. The most rewarding thing about my role is a child's smile. So when a child says, I want to learn to play football, getting them to be able to play football and then they say, I've joined the football team, thank you so much, that's amazing. And equally, the heartfelt thank yous from parents who say, finally, you helped me understand why is my child struggling with this and how I can help them. Nothing beats that.
My name's Jerry Bates and I'm a speech and language therapist. Probably what people think of speech and language therapists is people who help people who are struggling to say sounds, but we do a great range of roles. So from working with little babies who are struggling to eat and drink, all the way up to teenagers with autism who need support to make friends. So it's a really varied role. I love working in the community because that's where children and young people and families are. Speech and language is not something that can be taught in a session in a clinic. It's something that happens all day, every day. So a huge part of what I do is I help other people to best support children. So that might be teachers, it might be parents, it might be grandparents. So being kind of really embedded in a community, I think absolutely means that we make the most difference for children that we see. BCH is a company that really puts its people first. Because it's a community company, has a real sense of community and is very much part of the community that we work in. Having worked in an acute trust previously, which didn't have the same understanding of community services, I really appreciate the fact that BCH gets it really. They get what it is about working in a community.
My name's Helena Fenton and I'm a specialist speech and language therapist. For 4 days of my week, I work in autism assessment. So we go into schools, myself and a community paediatrician. We assess the children, come to a decision as to whether they meet the diagnostic criteria for autism or not, and then feed back to the parents on the day. And then for the other day of my job, I'm the team lead for school-age speech and language therapists in Bristol. If you work in the acute settings, for speech and language therapy with children, you tend to work in quite sort of a small specific area, which is usually swallowing assessments. But by working in the community, I've been able to work with a broad range of difficulties, and I've specialised in autism assessment now, but prior to that I was able to work with children with fluency difficulties, voice difficulties, speech sound difficulties, language difficulties, and autism or social communication difficulties as well. So I suppose by being in the community, I'm able to work with a broader range of children. Just in the last 12 months, I've been on a number of courses that have been both in and outside training, which I feel has developed my skills in both my assessment and therapeutic approaches. And also I've been able to take on a team lead role, so I feel like I've been able to develop my management skills as well.
I'm Tanya McGrath. I'm a specialist children's physiotherapist working in Bristol and South Gloucestershire. I think working in the community offers you the opportunity to really think about holistic care for the children and young people that we treat. It allows you to look at their lives and the things that they want to participate in, and really develop relationships with them that can establish over a longer period of time, and that allows you to deliver more patient-centred care. The best thing about the service is probably being able to work with lots of other clinicians and really come together as a whole team to develop a service that best meets everybody's needs. I think the most rewarding thing about our role is to be able to see a child or young person reach their potential, and that's quite often a really personalised goal. But when you can work with the child and family and really pick out what's important to them, what's important to their quality of life, and help them to achieve that, it's the most rewarding thing in the world.
My name's Jackie Lovell. I'm Health Visitor Clinical Lead. I think clients would say that we offer them a very good service, and we offer them 5 universal visits of every single family. So we see them antenatally, we see them at the new birth visit, we see them at the 6 to 8 week visit, we see them at the 9 to 12 month visit, and we see them, the children between the ages of 2 to 2.5 years old. I'd recommend working at Bristol Community Health because it's a social enterprise and we're all part of the company and we own part of the company. It has excellent opportunities and also a lot of staff benefits, including we follow the agenda for change, so increments and pay is in line with the agenda for change. They've helped me develop my career by giving me the tools to do the job which I do. So regarding public health, they've given me training towards mental health training, the postnatal and antenatal training. They've done solihull training. Also within my role as clinical lead, they've given me management training as well.